Welcome to Health Connection, your source for better living. Today we're talking with Dr. Marvin Almquist on urinary incontinence. What is urinary incontinence? What are some of the other names for it? And who does it typically affect?
Urinary incontinence, by definition, is the involuntary loss of urine, whether it's male or female, and we're specifically talking about women. Other names that you may hear is overactive bladder or urgency or so on. Those are actually different types of incontinence, but the basic is involuntary loss of urine that the woman cannot control. Does
this generally affect women?
Women more so than men. Women, at approximately 10 to 35% of all women, will have an issue with urinary incontinence in their lifetime.
What is the normal frequency of urination?
Normal frequency would be around 2 to 5 times per day. Increased above that, 6 or more is considered frequency.
What are the different types of urinary incontinence?
The three main ones is stress urinary incontinence, which is the loss of urine due to increased pressure in the bladder. The other one would be an urge incontinence, which is the urge to go to the bathroom and the leaking with urine by getting an urge. There is also the third type, which is a mixed incontinence, which is a combination of both urge and stress incontinence.
What are the most common treatments for urinary incontinence?
Most common treatments would involve several things. Usually you start with, is it a medicine causing? You can change the medicine. Is it a anatomy problem? Then that has to be addressed with pelvic floor exercises, therapy. Physical therapy can be involved. Is it a more substantial medical illness, such as obesity or diabetes, or that would need to be addressed with lifestyle changes, diet changes, and so on. And then all those could possibly include medical therapy, medicines, and then there's surgical options.
In the past, mesh products have been used to aid surgeries. How are these products used?
There's several mesh products that have been used in stress urinary incontinence. Some of them are still on the market, some are not on the market due to various reasons. The thing with mesh products is they can be very, very safe in the hands of someone that is experienced and knowledgeable and putting them in place for the right reason. You can expect about a 95% improvement in your urinary leaking with some of the mesh products.
What should people be aware of when it comes to urinary incontinence?
People need to know that it's not a life-threatening, but it's a severe quality of life issue. It is estimated that over $25 billion are spent annually in medical care for people with urinary incontinence.
For more information, subscribe to our podcast on iTunes or visit us online at ketteringphysiciannetwork.org.